Hello, everyone. Thank you for joining us. Let's just give it a couple more seconds for people to join. Thank you for joining us today. I'm super excited for this conversation with the Gaming of Color fellows and one of our mentors, Russell. So again, thank you everyone for joining us. I think this is a highly expected conversation and something that we really are pushing to put out there to increase awareness about doxyPEP. And although this conversation is not necessarily clinical, we will be sharing some data about the uses of doxyPEP for STI prevention. But today's conversation will be centered in advocacy. What the community is doing to put the message out there, what is needed, and what we have to continue to be doing just to make sure that this quote unquote new technology or more like a new approach to using doxycycline is used, and also to increase the uptake, particularly in communities of color where we see disparities in STI numbers. And before we continue, and just to allow a little bit more people to join us today, I wanted to mention, this is the shameless plug, I wanted to mention our CDC grant where you can get more information about HIV prevention and testing. We are partners with the CDC around the Let's Stop HIV Together campaign. When you access the campaign, you can find social media toolkits that you can use on your own social media to inform your community about where they can get services and to increase awareness for HIV prevention and treatment. And also, you can order self-tests that arrive directly to your house. So again, thank you so much. And I wanted to, before we start, I want to introduce our fabulous panel for today. We have Russell Campbell, which I mentioned he is one of the gay men of color mentors that we have as part of our program, supporting the fellows in their as they develop as advocates and as professionals. And Russell is the director of the Office of HIV/AIDS Network Coordination, also known as HANC, based in Seattle at the Fred Hutch Cancer Center. And HANC provides oversight and strategic direction for all cross-network coordination activities. And Russell is a leader with a career that has been dedicated to providing support in the areas of public health and racial justice. We also have one of the Gay Men of Color fellows, Andrew Ogata. He's a fourth-generation Japanese American who hails from the small town of Kealakekua, Hawaii. I hope I didn't say that wrong. With a deep-rooted connection to to his heritage and community, Andrew works as the director of marketing and development at the Hawaii Health and Harm Reduction Center, one of the oldest and largest HIV service organizations in the Pacific. We also have Raul Marca, who's the director of the director of prevention for the sexual and behavioral health programs at the Wyckoff Heights Medical Center in Brooklyn, New York. And he has been working in different areas of New York City, and he has expertise in marketing, social media messaging around HIV and doxyPEP, and also around language justice. We also have Victor Luna, who's originally from Mexico, where he began his journey in the government there around 2006, then in New York City, and where he became deeply involved in community-based initiatives around immigrants, LGBTQ populations, and sex workers. And he has a background in healthcare navigation and community outreach. So again, thank you all for joining us. I'm super excited and privileged to be able to share this space with you. And I am going to pass it over to Russell, who will be helping us navigate this conversation. Thank you all.
Thank you, Damian, for that wonderful introduction. And we are excited to be able to present this to you today. And I just want to highlight what we plan to cover during our conversation. So we're going to be talking about the history and uses of doxycycline, doxyPEP. We're going to be talking about the role of community advocacy in increasing awareness around doxyPEP and discussing the efforts of various organizations and individuals in creating supportive resources, as well as discussing advocacy strategies really focused at implementing doxyPEP, looking at it through the lens of equity, specifically addressing the needs of community of color. So I wanted to take a step back. So as we talk about doxyPEP, so I don't know how many folks are aware of the history of doxycycline, but doxycycline has been around for a while. Um, Back in it's as early as 1960s, and it was developed by Pfizer. And this just highlights some of the uses of doxycycline as it was approved by the FDA back in 1967. And you can see uh, when we talk about sexually transmitted infections or STIs, we're really talking about those that are attributed to bacterial origins. But you can see that there have been many uses of doxycycline, and many of us have been using doxycycline outside of STI. So it's been around. So this is not new. So oftentimes when we think about various interventions in the context of HIV, we think about, oh, this is something that's new and novel, but doxycycline has been around for quite a bit of time. And as we talk about doxycycline in the context of STIs, just wanted to just set the stage for why we are even talking about doxycycline. And I can't see what's in the chat, but just wanted to make sure that we're all clear when we talk about PEP, uh, post-exposure prophylaxis. Can anybody maybe put in the chat and tell me when we say prophylaxis, what is prophylaxis? And Damian, I'll need you to help me with that because I can't see what's in the chat. But who can tell me what prophylaxis is? Because sometimes we throw out terms and we just need to be clear, especially when we're describing these to individuals and communities, what we mean. Let's see here.
No responses yet.
Okay.
I hope people attending can see the chat function.
Okay. All right. So I'll just tell you, I don't see anything yet, but when we say go ahead, Victor.
Melissa mentioned the chat is disabled.
Oh, I see. Let me
Okay.
see what I can do in the backend.
Okay.
Also, please feel free to use the Q&A box if the
Okay.
chat function it doesn't work. Yeah.
Thank you. Thank you for letting us know. So I'll just, in the interest of time, I'll just say when we talk about prophylaxis, it's something that's used to prevent something. So to prevent disease or infection. So we're talking about something post-exposure, that means after exposure to prevent. So when we think about sexually transmitted infections, and for today, we're really highlighting syphilis, chlamydia, and gonorrhea. There's been an increase in the U.S. of syphilis, chlamydia, and gonorrhea, and those have been disproportionately impacting gay, bisexual, and other men who have sex with men, as well as transgender women. There were 3 large randomized trials that were conducted looking at 200 milligrams of doxycycline taken within 72 hours after sex. And those trials demonstrated that taking that amount reduced syphilis and chlamydia infection by over 70% and gonorrhea infections by approximately 50%. So after looking at those trials, the CDC put out recommendations around the use of doxycycline for PEP and focusing on addressing those infections, syphilis, gonorrhea, and chlamydia. And the recommendations are for providers to provide individuals who are who have had previous um, STIs to take doxycycline within 72 hours after having oral, vaginal, or anal sex. And one of the things that we want to highlight today is this is in addition to really looking at this in the context of, comprehensive sexual health approach, in addition to talking about, looking at counseling, STI screening and treatment, all focusing on ways to make sure that, those sexually transmitted infections are addressed. So one of the things that we're going to be hearing today from some of the individuals who are working on this in terms of engaging with communities is just really figuring out what's the best way to approach this. And one of the things that when we did this session at USCHA just a little bit ago, we heard from providers as well as individuals in communities around what they feel needs to be done in terms of efforts to make sure that our communities are healthier. So with that, I will stop and turn it over to, let's see, who's the first person? Let me stop my screen here. Give me just a moment. I am looking for.
And while you get that, I want to let the attendees know that we cannot, sadly, we cannot enable the chat at this point, but you can use the Q&A box to send the panelists your messages and questions.
Okay. Victor, are you up?
Yeah.
Thank you. Victor.
Perfect. So first, Jose and Alan, they sent two things in the Q&A box. One of them mentioned prophylaxis is preventive, and Jose says it's prevention. It's preventive too. So let me go ahead, and like Damian said, I want to first, appreciate, thank you for organizing this, but also make sure that we are in a safe space where we can communicate openly, so it's easy to understand for everybody. Pre-exposure, post-exposure prophylaxis will be PEP. It stands for when we already have sex with someone, or we have sex condomless or with a condom, it breaks, and then we've been exposed. We believe that we've been exposed to any of gonorrhea, syphilis, or chlamydia, and then we have this period of time, 24 to 72 hours, to take the two pills, the 200 milligrams of doxycycline, that will help us to prevent these STIs. That's the post-exposure prophylaxis. That means that we feel that we were exposed before. Saying that, I really believe that this way of use this treatment allowed us to be responsible and in control over sexual health. Because whenever we are in a risk situation, we normally are scared, and then it passes a few weeks in order to you go ahead and take first, like the first step to get tested, then like you feel ashamed. But with doxy allows you to have that control and prevent something that is preventable if you are in top of your sexuality. Something that we mentioned in USCHA, and Raul, you want to support this, is that like whenever we allowed us to be on top of sexual health, it's taking control of ourselves and our health in the end of the day.
And then I'm just going to add that I think this is something very important, that this is what we're doing here, or what we were talking. So we try to talk to the community about how empowered they need to be to know all the tools that they need to have to prevent any type of STI of HIV.
1000%. That it's also, even as an organization, as people who promote the healthcare for our communities, it's very important to give access, because this webinar is in English, but also we speak Spanish. We speak many different languages, and sometimes the information is not there on the level that it's very digestible. Like we are familiar with certain terminology, but also the people that we serve, they may not be. So we need to help to do the translation, the localization, in order for all the communities to understand how to prevent it and how to take advantage of these new ways of technology, these new ways of using of doxy.
Thank you. I have a question. I'm gonna put this question out there, and then I'll have you respond to it, Andrew, Raul, and then Victor. So, are the communities that you work in, would you say that they're aware of the introduction of doxyPEP? Andrew, we'll start with you.
I think we're just at the cusp of people becoming aware. The way I look at it when I'm out in the community, we're where we were in like 2012, 2013 with PrEP. It's still educating people. And even in my own personal life, when I'm meeting people and I'm having sexual encounters, I'm having to educate them. Like, are you on doxyPEP? And they have no idea. They think I'm still talking about PrEP for HIV prevention. So it's really about that educational piece. And so we learned so many lessons, right, in 2012 with the rollout of PrEP for HIV. So I think that just really taking those lessons learned and just trying our best to make sure that the messaging is going out to communities that are most in need.
Thank you. Raul, how would you respond to that question?
So I think it's like, I think what we was talking, it was something important that how like some community they already know, but all of them they don't know because they don't have the specific tools or they're not in their language. And this is something that's what I'm doing. Like I take all the information that I got, for example, for the CDC page or for all the tools that it gives me, and then I translate all those information in my language in Spanish. And then this is something that's making like so deep, like so powerful, because when I post anything like on my social medias about like doxyPEP or STIs or HIV testing, people they're very engaging. People they've been saying like, "Hey, I didn't know about this. Can you explain me more?" So that's something like when I was seeing that, this is something like, okay, we need to do this more. So that's why I was focused a lot to do more of that.
Thank you.
I see Devin have a question. He mentioned, can you repeat what is the effectiveness on the prevention of doxy in this? And syphilis will be 70 to 73% based on the CDC studies. Chlamydia will be 70%, and gonorrhea depends of the variant that you may have and also the region that you are in. If that clarified the question that you had, Devin.
And Victor, for you, how would you say that the communities that you work in, that they're aware of the introduction of doxyPEP?
It's I really don't think the people. Let's see in these two different directions that there is like so many questions that we have. One of them is the people, the communities that we work with. It's also the providers that we work. Also the people who deliver the services. It's us. We are a part of the community that delivers services. Not all the providers here in Miami. There is the place that I am. I mean, in Florida, I help to oversee Florida State too. So certain providers don't have the full information and awareness on the effectiveness. So it's misinformation there. But as we move forward with this, like application of this way of prevent STIs, like the awareness in that side, it's becoming more. The access of the information is there in the CDC. You can go to the website, and I'm sure we can provide with the links. But also in the other side, as a user, I'm very proud because, and I share with you guys this, last time I was positive for any STI, it was a long time ago, thanks to the use of Doxy responsibly, like just after 24 hours, before 72 hours, I've been taking it. And also the community, we support, not necessarily is like the entire state of Florida, the entire Miami-Dade County. It's also the people that we have relationships like Drew mentioned before, like we're having encounters, we're having sex with different people just to be like, I'm going to protect myself, letting you know that I'm using, Doxy, but also I let you know, and I'm going to explain to you what is it. It's been a few friends, I have friends who works in the entertainment industry for OnlyFans, etc. And they are not aware of these, but they are part of influencers on their own community. Here in on Organization and Prevention 305, we collaborate with them and they also spread the word for them. So I think we have to target who is the people who can just spread the word, even if it's you with your own friends, with your own community, with your own sexual partners. So I think that's how we spread the word.
Thank you, Victor. Victor, something you brought up, you talked about providers, and this question is related to, and we heard from providers who were in our session at USCHA that, you know, this process, there's a learning curve for them. So my question to the three of you is, what work, if any, are you doing with providers, local providers in your area and or health departments to talk about this so that providers are more comfortable and or aware so that they in turn can help make sure that, you know, individuals in the community are taken care of? And I'll start with you, Raul, then Andrew, then Victor.
Okay, so for example, like I'm gonna talk about my experience. So in the beginning, when I was start hearing about doxyPEP, so I went to my appointment and then I talked to my provider, like saying, "Hey, I'm here about doxyPEP. Can you tell me more about it?" And then my provider told me like, "What? What are you talking about?" And I was like, "Wait, I just hear about this, and then I think this is what will be a good tool for me to protect myself, to don't get any STIs." And then I mentioned to my provider like, I'm very sexual active. I have different partners and like I have different partners. So I think that will be a good tool. And they told me like, no, I can't provide this because this is not approved yet. And then I work in a hospital. So in my hospital, like we have, like let's say we have 6 providers. 3 of them, they agreed to use doxyPEP, and 3 of those, the other 3, they don't want to use doxyPEP. So I'm being with them right now, like talking, showing the policies, showing all the resources that we have, telling like why it's important to continue educating people about doxyPEP and how it's important that, because the community is being asking us, community is being asking providers like, I need doxyPEP, but because maybe you don't trust or maybe you have this type of barrier to give doxyPEP to the community, you don't want to provide it, or at least how we can do a plan. So what I was doing with my top providers is, what we're going to be forcing more is do more sexual education. How important is to talk to your partners about the different ways to protect yourself using doxyPEP, but at the same time using condoms, and talk about, because one of the providers told me like, oh, because we don't want to give doxyPEP because, you know, like people, they can get more like used to it, and then maybe like the medication, they don't want to work later on. So but that's why it's important to continue educating community and saying like, okay, this is when you have any specific incident, so you can use doxyPEP. So I think it's yeah. So I just gonna finish saying like, I think it's maintain continued education, talk to your providers to continue screening to your patients about STIs and doxyPEP. I think that will be the key.
All right. Thank you for sharing that, Raul, both your personal and professional experience in that area. Appreciate that. Andrew.
Yes. I'm a personal user of doxyPEP, but I also do marketing for our agency. We are a community health organization. We offer doxyPEP to the masses here at H3RC. But Hawaii is unique in the sense that a lot of people go outside of their PCPs to receive care when it comes to STI treatment and prevention. And we're very fortunate that the 2 major STI centers are very on board with doxyPEP. But I think the missing link right now is the education piece, and educating the masses as to what questions that they need to be asking their providers to get on doxyPEP, because they shouldn't have to be going to these specialty clinics to get these things, like something as simple as doxyPEP. And so, you know, in my professional role, I create content for social media and our communication strategy here at H3RC. But in my personal life, I'm also just constantly talking about it. You know, I work in a nightclub as well. We talk about it there. Just trying to educate the masses about, these are the questions that you need to be talking to your provider about. You need to not be ashamed to talk about your sexual encounters with your providers, so that way that they can help you better understand.
Thank you. Victor.
I remember, Andrew, and that you mentioned, so just to frame a big picture of the misinformation and different information the providers may have. You mentioned before that like it was a provider that gives you one dose and then the other provider provide like 7 encounters, like just to unify that message, it's very important. Go for it, Drew.
Oh yeah, there are different providers within everywhere, right? Like different providers have different preferences. I myself, when I go to Kaiser, I'll get like 30 doses. I'll get like 30 pills, 15 doses easily without questions asked over the phone. Versus if I have friends that have gone to private providers that have given them 7 days worth, so 14 pills, so, and there are some providers that will only give one dose, so 2 pills. And so it's just it's just that education piece. But I mean, following that CDC guidelines, that's what the providers are going to do. It's their medical license, so we really can't pressure them too much. But just making sure that everyone is understanding of the CDC guidelines as far as what to provide the proper prescribing measures are.
Yeah, and in this part, something that we mentioned before is partnership, but the partnership is not just with, sometimes we see partnership with other organizations, with like government, but even including the pharmacy. I don't know if you can pull up the bottle of Doxy that we have in the presentation. That's actually my bottle of Doxy, but it says how to use it, how many doses, like, and that's information that like we need to have it, because when I have, like just the bottle, I don't know how to use it. Sometimes I forget, like it's people who take many different, pills a day. And just to have the resource with the labeling, that means talk to the pharmacy that provide the services. You know what? I know it will take a little bit more ink, but let's make it happen. And there is the description on how you have to take it, what is the timeline that you have to take it in order to be, more successful. And then the dosage, like it's just 2 pills. For in this scenario, they provide me with 25 encounters. And I think it's very important that we understand the power that we have as a clients, as a people who also spread the word of prevention, in order to go knock the door and say like, why you are not doing this, can we talk about it? It's in sharing my personal experience. I remember when I moved to Miami, my first labs, I request, like prep labs, and they didn't want to give me the oral swabs or the anal swabs. And I was like, I am telling you that I need them, like, and no, but it is okay. You can just do the HIV. And I was like, no. And I have to speak with them, and I have to talk, like to the provider again, in order to, like they give me what I need. And in this case, we are just like understanding the world different and helping to do different partnerships and helping to understand what we need in order to be well.
Thank you, Victor. That I want to. This goes back to something that Andrew mentioned, and this question is, how do you think telehealth can bridge the gap for those without direct access to healthcare services, particularly for doxyPEP? Because and Andrew, you gave an example of if you call in on the phone, you might have a different experience than if you're in person. So maybe if you guys could speak to that. Andrew, I'll start with you, and then Victor, then Raul.
I think telehealth is an amazing tool for all of us, right? Conversations a lot of times are much easier to be had behind a phone, behind a keyboard, versus in person, talking to your provider face to face within a couple of feet, telling them how many sexual partners you have. So many people are so much more comfortable over the phone. Even within some of the systems, you can even have a chat feature. So, I think that telehealth really allows people to, even though your name is attached to it, have a level of anonymity to really feel more comfortable with having these conversations. But that's where we step in, right? Like, we need to break down this system. We need to break down this stigma. Like, people shouldn't be ashamed to be talking about their sexual health. And that's where webinars like this, where we have people with firsthand experience talking about it, like, are so helpful.
Okay, thank you.
Talking about telemedicine, basically that's the program that I help to oversee here in the state of Florida. We do all the services of prevention, PrEP. Now we also are able to help with HIV treatment and care, and everything that we do is through telemedicine. We deliver the labs for gonorrhea, syphilis, chlamydia, hepatitis B, and HIV as well. It's an easy box that you receive. It's very discreet. That's also other thing the telemedicine allows you to do. You know, like you can be just at your home, you receive everything. You're not gonna forget it because it's more ways in order to set up reminders than the easy access, the convenience of it. One of my experience when I moved to the US back in the day, you know, I have to work like long hours during the working regular hours that is 9 to 5. So for me that I was making like, you know, like tight money in that moment, I have to request 1, 2, 3 days in order to go for labs, in order to go to see the doctor, and then go and pick up the medication because they wasn't delivering. And I believe that telemedicine just break down barriers that helps you to be in top of your care. Easy access. You don't have to waste that many days, you know, like that many hours. I don't know how many times it happened to you guys, but like when I used to go to a clinic, I have to wait 2 hours for labs. And that means for a lot of people in our communities, including me back on the day, that means that I will lose $300-$200 just for not go that day to work because I don't have PTO. You know, like that's a lot. And that's something that sometimes if we are supporting family here or in Mexico, in my case, you know, like we cannot lose these days. We have to make decisions. And sometimes it's like, am I gonna eat? Am I gonna pay the rent? Or I go and do my checkups and I have to do it. So because money sometimes is more important than everything. We just leave our health on the side and we just like get an STI and we don't get PrEP. And then everything is like a consequence of easy access. And telemedicine break down that barrier and help us to like automatize time and effort.
Yeah, I think I'm just gonna add very quick, like for example, like I think that will be one of the increases that will be increased accessibility, specifically like for geographic barriers. So people like we know like they can live very like individuals that can be like very in rural places or very underserved areas. So telehealth will be very like quickly so they can get information specific now about doxyPEP. For example, like privacy, like people they can just be in their own space, making sure like they can talk to the provider. They're gonna feel more comfortable to talk to the provider in the privacy setting. Another part will be so I think that will be I think my team everyone there already talked about it, but I think telehealth will be very good for promoting and educating people for doxyPEP.
Thank you. So this question is related to something, Andrew, you talked about, you know, the people maybe feeling more comfortable talking on the phone about, you know, their sexual health and with a provider. So can you all speak to the issue around sexual freedom and sexual responsibility and how those are interconnected in regards to doxyPEP? And Raul, we'll start with you.
Okay, I think it's for example, like sexual freedom, like this is something I've been promoting on my social media. I've been talking to people saying like how you can talk to your provider. I think I have a video, like I explain to people like there and how to like ask to your provider about doxyPEP. What type of questions you can give their to provider about it. So I don't know if we can share the video. So
Yeah, go for it.
Okay. So
I think you can share. Yeah.
Let me just do it. One second.
Don't forget to subscribe and follow @RaúlMarca.
I know.
You have a lot of good content. So there is it's good resources for people that need education and resources in different languages. So like definitely it's something that like it's good for the community.
Everyone that can see the video.
Yeah. The audio, try to.
We can see it, but there's no sound yet.
There's no sound.
No audio, no.
But about
Lip
now?
sync.
Oh, that's right.
Yeah.
You can hear any, you can hear?
No.
I think it's the way
To
it's set.
press,
Okay, got
there's
it.
a check mark to share audio. Yeah.
Okay. So let's do it.
How to ask your
Now?
doctor for doxyPEP.
Good.
Okay, perfect. I will be doing again.
How to ask your doctor for doxyPEP. Many health departments recommend doxycycline to reduce the risk of acquiring chlamydia, gonorrhea, and syphilis. So your doctor might know about doxyPEP. If your doctor already understands doxyPEP, then great! Feel comfortable to asking for a prescription. To ask for doxyPEP, you can say something like, I want to reduce my risk of getting STIs, and I think doxyPEP can help. Can you prescribe me doxyPEP? Or you can also say, I hear that doxycycline can be used to prevent some STIs. It's called doxyPEP. Can you prescribe it to me? If your doctor doesn't know about using doxyPEP to prevent STIs or will not prescribe it to you, you can do a number of things. You can share information and data. The link below is a good resource to show them. You can also talk to another provider within the same clinic or elsewhere. It might be possible for you to talk to different providers about doxyPEP. doxyPEP is all about taking more control over your health. It can feel awkward to talk about the sex are you having, but it's so important. I encourage you to bring up doxyPEP next time you see a doctor. For more information, check the link below.
Thank you.
Well done.
Thank you. Let me see how can I stop sharing this.
You got it.
I don't know how.
If you scroll up to the top, there should be a drop down maybe. Just,
Yes.
and it'll say stop sharing. Stop
Oh, they
share.
say-
There you go.
Perfect.
Okay,
You got it.
perfect.
That's great, Raul. Thank you for that.
So, but just like, because right now I just show you like in this specific in English, but I did the same video in Spanish, and that video in Spanish like have a lot of views. People there really like send me message about like thank you, and they show those videos to the providers, and because I have links attached with the videos, they show the video like the attachment, say like, oh, this is what I see. So that's why I think it's very important to continue doing that.
Thank you. Andrew?
Would you be able to, sorry, I feel like we kind of went off on a tangent. Can you repeat the
Oh,
question?
yeah. So just talking about sexual freedom and sexual responsibility being interconnected in the context of doxyPEP.
Okay. Yeah, no. Well, I'm a big dork, but I'm going to quote Stan Lee in saying, with great power comes great responsibility, right? You know, we are the carers for our community. Here in Hawaii, you know, we're a very transient community. We see millions of tourists every single year. We're heavy militarized. You know, we have a lot of people that aren't connected to the island that are coming through, and you know, there's a lot of chance to bring in diseases, there's a lot of chance to bring in infections, and so it's up to us that, you know, if we're going to be out playing in our community, it's our responsibility to not only take care of ourselves by taking our own doxyPEP and reducing our risk, but you know, that also reduces the risk that you're transmitting it to someone else, and also having those conversations with your partners and really educating.
Thank you. Victor?
With that, I'm gonna say this example. I love Pride. I love to go to like LGBTQ plus events all whenever I can to do it. So like just to go there. Sexual freedom, it's one, take control of myself and take care of myself. I think that gives me a lot of freedom. But sexual responsibility, that also means that I'm gonna take care of the people that is around me. And this resonates with Andrew, like every time I go and I travel, I do my labs at least 20 to 15 days before I'm gonna travel, because if I have something, I have to take care of it. If don't, I bring my doxy and I make sure to take it. Um, because something that we mentioned before, importing and exporting STIs. That's very common, because it's some people that can go for, I live in Miami and then I travel to Mexico City Pride, but I didn't do my test in a long time. So that's, for me, that's irresponsible. And because I love myself, I love my country, I love the people that I'm around, I'm gonna taking care of them. And that means that if I see myself and I take care of myself, the other people around me will be taken care of too.
Thank you. So, Andrew, you brought up living in Hawaii, and so this question is related to, can you, and this goes to all of you, but we'll start with you, Andrew, discuss any specific challenges or developments related to doxyPEP in Hawaii or near border regions?
This was something that came up at USCHA. Well, when we were preparing for USCHA, we were talking about colonization, and the US military and its effects on different communities. And it got me thinking, so I did my own like internal polling. So I hit up a couple of my friends that I knew were part of our LGBTQIA plus community, but also serving in our military. 3 different branches, and I asked them straight up, like, have you heard of doxyPEP? I was like, I have a weird question. I was like, in my day job, because I see them out at the nightclub every weekend, right? But I was like, in my day job, I do this kind of stuff. So I have a weird question, but do you know what doxyPEP is? Are you interested in it? All 3 resounded like, I've heard of doxyPEP. I've always wanted to be on it, but I haven't been able to get on it through the military. And that brings up a big question, because in regions that are heavily militarized, they're not just staying on the bases. They're an entire another community that we could be reaching out to, because they're out in the same nightclubs, the same bars, and they're playing in all the same pools that we're playing in. So, it speaks back to PrEP, right? If one corner of the community is not accessing this vital tool, it puts all the rest of the communities at risk, right? So it really is important that we reach all corners of the community, from the military to the locals to the visitors, so I think it brought up a really interesting question, and now we're involved in some further conversations with the Department of Defense. So I think it's really cool that something might actually come out of this.
Thank you. Victor.
There is 2 questions in the Q&A. I want to say, Kenzie, she say, this may sound stupid, but can you do PrEP and doxy on the same time? Casey, no, any questions is stupid. Like, if we have the questions, feel free to do it. Feel free to question ourselves, because we learn together. And yes, it's not contradictions in taking PrEP and doxyPEP, so it's totally fine. As a personal user, I will say, let's do it, like separate, like the PrEP in the morning maybe, and then with food and a lot of water, take your doxy. Like, water is very important. Then the other question was, let me see, from Jose. Any long-term effects for doxy? Any hepatotoxicity potential? And how long is being the study? And then, is under investigation or in an open communities? Anyone want to answer?
So I'll say, so one of the questions, I'll frame it this way. So I think one of the main concerns for most providers has been in prescribing doxyPEP is increased antibiotic resistance. The amount that the 200 milligrams has been proven safe. There have not been any noted issues. One of the things, if you do take doxyPEP, that you're advised against is thinking about if you're out in the sun, making sure there's sunscreen because there's sun sensitivity. For some folks, taking doxyPEP, I've been taking doxyPEP for years for something else not related to STIs, but I always take it with food because some people, if you take it without food, at least for me, it's like I feel it. So, I think the sun sensitivity, thinking about making sure you take it with food enough water. And it's important to make sure you swallow the capsules, because if it gets stuck here in your esophagus, that could be problematic. But the side effects have been, pretty mild, but nothing in terms of long-term problems.
Yeah, you can maybe experiment some diarrhea. Your belly will be a little inflamed, but like overall, with a lot of water, with food and timing, I think it's good. Never do it when you're hangover. Wait till you have food and then drink a lot of water.
Yeah, yeah, and the other thing I would say too, like if when you take it, like if you take it later at night, they advise you to like be able to sit upright at least for 30 minutes before you're reclining. So if you're going to take it before bedtime, take it at least 30 minutes. Make sure you drink lots of water. So those are, but nothing in terms of long-term, effects have been noted in terms of the amount. So I'm just looking at the time. I think I wanted to make sure. I know, Andrew, you answered the question in terms of Hawaii, but I wanted to make sure Raul and Victor, if there were any things related to near border regions around challenges and/or developments related to doxyPEP that you wanted to speak to.
So, for example, like what I was talking, for example, like I think the prompt access. So if someone they're going to the provider and the provider say like, oh, we don't want to prescribe you. So the time is happening. So that's the thing is something one, I think that's one of the challenges. So that's why it's very important to all providers, they need to know about doxyPEP. And other thing is will be social stigma. I think is people there where we're gonna be asking for doxyPEP, maybe they can be stigmatized. They say, oh, you're using doxyPEP because you have several partners, or what are you doing? So that's the reason, like, I think is how important that we need to continue promoting, like, promoting this type of campaigns or those type of webinars, so people, they can understand what is the reason why we promoting doxyPEP.
Thank you. Victor?
Definitely it's barriers in the borders, barriers with like international travelers all around, but I think it's very important to make sure the partners with like that we do in the Mexican border, for example, the people who come in, we have to make sure to provide these services so they are aware and they also prevent themselves to have any other STIs. I think this is very related with partnership and sexual responsibility. When you're going to travel to Hawaii, to Puerto Rico, to any other island, or just out of the country, or even another city, make sure that you are aware of your status. You have to be aware of you have to be in top of your sexual game. If we like to play, we better know the rules, because that's the only way that we're gonna win the game. That's it. Like, period.
Thank you. And Victor, I know you had your pill bottle. I just wanted to show, I don't know if the camera, this is,
Yeah,
it looks like.
regular pill.
Yeah. Let's see. Do we have any, I think, questions? Let's see, Q&A. So it looks like from Devin, and for clarity, this is for people who are negative for STIs. If you have symptoms of an STI, you should be treated as the dosages would be different. Absolutely. Thank you, Devin. And this is the thing. So, if you go see your provider, And Victor, I think all of you spoke to this, making sure that your providers are screening you for STIs. And if you are testing positive for any STIs, of course you would be treated, but going forward, doxyPEP would be an option for you to make sure that, and Victor, you noted that, like, that since you've been on doxyPEP, you haven't had to go to your provider to get treatment, and that's the whole purpose of it, to prevent the acquisition of STIs. Let's see. Recommendations for convincing providers who are hesitant about providing throat rectal swabs. Question for the panelists. Well, and this is from Julian. What would you say to Julian? Any recommendations for convincing providers who are hesitant about providing throat and rectal swabs?
Don't leave the clinic till they give it to you. Like, again, like, we have to make sure that we have remember, we have the power. And if we just give up, like, oh, they don't want it, what I'm gonna do? No, I'm here. I lose the entire day in the clinic, so you better give me what I need. And I think I'm telling you, I need it. So, like, the first recommendation, don't leave. Remember, people there in the clinics, they are there to help you. That's the main reason why we are doing this. Talk to your prep navigation, to your, like, any navigator that are there. I'm sure they can help you to give you access to exactly what you need, because sometimes we are like, we have different train, more human train, in order to understand the necessities of our community.
Thank you. Raul and Andrew, I'm going to throw this question to you from Elena. How can we adapt messaging around doxyPEP to resonate with diverse communities without reinforcing stigmas?
I can go ahead and start. I think representation matters. I think anytime with messaging, have the messaging represent the communities you're trying to reach. I think that, to me, is the easiest way to break down stigma, because as someone that's looking at it, if you see someone that you relate to, that resonates with you, whether culturally, physically, anything like that, it's gonna help you feel more comfortable, and it's gonna reduce the amount of stigma that you're feeling about it.
Same thing, like make those resources available for everyone, for you, like where, like, the community that you focus. Like, if they're in Spanish, bring those resources in Spanish. If there's a specific dialect, do it, because that's what we need. What we need, like, to people know about all those resources. Another thing is, like, depends how you want to promote it. Use your social media, use your own platforms, like, if you do collaborations, you can do collaborations with maybe people that already have their own community, like, they influence our other communities. So use people that you already seeing, like, oh, influencers, or people that are being already in the field talking about it. So that will be help a lot your community and how you want to target to promote education.
1000%. Ellen, I just want to, like, quick point. Back in New York, working with the transgender community, there was a group of sex workers. Me in front of, like, like, the groups trying to give an explanation. I love it's part of our community, but I don't have the expertise of a lifetime being a transgender woman. So therefore, we speak with the leader on the community of the sex workers, and she started making these conversations more openly for that community. And that's why the way how we increase the number of the people who was engaged with the community, and also information that we don't have access, the living experience. Make sure to include that person who is gonna represent that part of the community that you are serving.
I love how the three of you responded to that, and really reinforcing the fact that representation matters, and wherever possible, having individuals who are using doxyPEP to say, look, I use this, and that way you're not talking about something in the abstract, but you have an opportunity to have people ask that person, those individuals, like, oh, this has been my experience. What else do you know? And that ties into the response that the three of you gave. Thank you for those. What other questions? So I'll just say this has really been an amazing opportunity to engage with you all. I just want to go around and ask the panelists if they have any closing thoughts they'd like to share. We'll start with Victor, Raul, and then Andrew, you can take us home.
You like to put me on the spotlight without any hesitation. Give me 2 minutes. No. First, I wanna thank everybody who attended today and the amazing panelists. Thank you, Rosa, for organizing this, and MAC, that is a great organization that gives us the opportunity and open space like this, that we have to make sure to do it in our own communities. Wherever we learn, whatever we are doing, we have to make sure it resonates around our community, the people that we serve. We have to take advantage of the technology that we have access now. We have to take advantage of all the tools that they are there sitting without any use, and make sure they get the right use. And if they are not in our language, we have to translate, we have to do whatever we have in order to deliver better services and help our communities, because we are part of it.
Thank you. Raul?
I would say, I think, like what we was talking about all this webinar is, we need to increase education and outreach. We have to provide culturally appropriate services to, like, specific for language justice. So all those type of resources that we have, please provide it in the language of the community you have. Reduce the stigma. Making those promoting all this, they're going to reduce the stigma to people that want to know more about it. So I think if we follow all these steps, we're gonna be doing better, more education to our community. So I would say again, thank you for having me, and then I know they've been sharing my social media there, so you can follow me there, and you're gonna find more resources that I have from the CDC for the campaign Let's Stop HIV Together.
I think we need more of this. Bottom line, like, I think we need to have more of these webinars. I think that we need to have more of these conversations. Like, I'm so thankful to NMAC for giving us this platform and this opportunity to reach so many people from across the country. But all of you that participated today, like, you could do something like this in your own community, you know, with your local providers, with your local outreach organizations, HIV, STI organizations. Like, I would love to see more of these, like, because these are a really easy way to set up, really low lift way to set up, so get so much information out to so many different people. So, you know, we have the technology now, so I would love to see more of these things like this.
Great. Thank you all. And, you know, I think that's a great recommendation, Andrew, for those of you who have participated in this conversation today. If if you're thinking about ways to engage with providers or health departments or people in your community, these three amazing individuals, you have their contact information, reach out to them. I'm sure they could help guide you, or maybe they would even be willing to volunteer to talk about their experiences to a group. So please, this is an opportunity. So thank you all. Damian, thank you so much for organizing this. And I hope you all enjoy the rest of your days and or evenings or wherever you're at on the planet.
Thank you everyone for joining. Thank you for your time, your expertise, and I hope that the attendees, if there's something that you get out of this webinar, is that the CDC guidelines are out there, it is safe, it is recommended, and that sometimes we do have to advocate for ourselves, and that way, and as Victor was mentioned, like, don't leave that seat, stay with your doctor until you get that prescription. I believe we are at a point, right, kind of reminds me where we were with PrEP at the beginning, where we have to push to make sure that it gets to the community, that we prove that the community wants this. So thank you everyone so much, and I hope that this is one more conversation of many others to have. Thank you everyone.
Bye-bye.
Muchas gracias a todos. Gracias.
Gracias.